Okay, so we're going to start off with the bovine male reproductive tract. We're going to look at a few structures, and we're actually going to start, we'll go ahead and start with the testicle down here, okay? So this thick layer of tissue that we see over top of the testicle is going to be the internal spermatic fascia. And then if you were to incise that, this is what you would get here. So on the inside here, if you make an incision longitudinally, open this up, we would be able to see the parietal lamina of the vaginal tunic. The parietal lamina of the vaginal tunic would be just next to the visceral lamina of the vaginal tunic, which is what's going to be covering the testicle. Here we can also see the tail of the epididymis, the body of the epididymis coming right up along here. And then unfortunately there's been an incision here along the head pole of the testicle, and the head of the epididymis has been removed, but now we can see the ductus deferens leaving it. So here we're back to the original testicle, so we see essentially the entirety of the spermatic cord here with the cremaster muscle attaching onto it. Now let's come and talk about some of the accessory sex glands. So what we're looking at here is a dorsal view of the accessory sex glands. We see these two large pieces right here in the middle. Those are the ampullae of the ductus deferens. We see these two glands bilaterally, one on each side, that will essentially look like a small bunch of grapes. Those are going to be the vesicular glands. And finally, if we look, they're just caudal to those vesicular glands as these kind of two bilateral bulges. That's going to be the body of the prostate. The body of the prostate is lying right on the urethra. And then if we incise this area, we will see that very thick urethralis muscle running right along the urethra. If we open up this area right here, we are now looking at the dorsal wall of the bladder and urethra. In this area, we can see the trigone of the bladder where the ureteral orifices are. The trigone leads to the urethral crest, which then in the male leads to this structure, which is the colliculus seminalis. It's on the colliculus seminalis that we will have the openings of the two ejaculatory orifices, which are just the openings of the two ejaculatory ducts. So if you pass a probe through the orifice, you would be passing it into the ejaculatory duct. In this region, there will also be some pretty tiny, mostly microscopic openings, and those are going to be the openings of the prostatic glands. As we continue to move caudally along the urethra, we will then come to the area of the root of the penis. And it's in this vicinity, just cranial to the bulb of the penis, which we will see right here, that we will find, again, two other bilateral glands, and those are going to be the bulbourethral glands. In the ruminant, they're pretty tiny, especially when you compare that to the bulbourethral gland of the horse or of the stallion. So here we're looking at the root of the penis, and if you think back, the root of the penis is formed by the bulb of the penis and the two crura. Now, each crus, which we can't see the crus necessarily opened up here, it's still inside this muscle, so each crus is covered by a muscle, which is going to be the ischiocavernosus muscle, and the bulb is going to be covered by this muscle, which is the bulbospongiosus muscle. Running over top, or superficial to the bulbospongiosus muscle, is going to be this long paired muscle, which is the retractor penis muscle. Now if we follow down, we are now into the area of the body of the penis. And in the ruminant, we see this kind of 90 or almost like 180 degree bilateral flexure here. That's going to be the sigmoid flexure. And that retractor penis muscle attaches to this distal bend of the sigmoid flexure. If we continue distally, Now we're getting down here to the area of the free part of the penis. And then we will also see the glans penis, which in the ruminant, especially in the bull here, we have this little tube leading up. That's actually going to be the urethral process. So the probe is actually passing into the external urethral orifice right here.